To talk to us more about the recent developments with the new variant is Professor Francois Venter, the Divisional Director at Ezintsha at the Wits University. Professor, a very good evening to you. Thanks for joining us. Welcome.
Hi, everybody.
Now, first of all, let's talk about Israel, as we've seen in the insert we've just played now. Israel downgrading the efficacy of this particular, virus. I mean, will it not, in the long term or in the medium to long term, undermine the COVID-19 fighting strategies?
So we see this in Israel and in the United Kingdom, in fact, with the AstraZeneca vaccine in the United Kingdom. Is that the Delta virus, which is the one that's wiping out South Africa at the moment, does seem to be able to break through the vaccine. It still doesn't put you in hospital, but it can make you feel pretty miserable, like a flu-type illness. And I think we need to anticipate this is going to happen with all the vaccines. We're getting anecdotes from around South Africa, including a whole lot of people I work with who have had the J&J vaccine for the moment, that the Delta virus in Joburg, for instance, is able to break through. It puts you in bed for a day or two, you feel a bit miserable, but you bounce back very, very quickly. You don't end up in hospital like you do if you're unvaccinated. So I think we need to make peace with the fact that this virus is going to be circulating and that we're going to need to find a combination of vaccine strategies to try and keep us as healthy as we can. Yeah. But we can take peace from the fact that both Israel and in the United Kingdom and also in the United States, the deaths are almost entirely amongst people who are unvaccinated. The vaccinated are getting it, but they're not getting severely ill.
And the decline coincided with the spread of the Delta variant. I mean, at the end of the social distancing restrictions that have been imposed on Israelites. I mean, this will certainly take the country 10 steps back, would it not?
Look, I think lockdown measures are very brutal and blunt instruments in terms of trying to contain the virus and its spread. And our societies are going to have to probably come to some sort of peace with repeated surges of the virus. I think everyone's realized the third wave, the second wave, and the first wave have all been approximately 6 months apart. And in many countries, that's the pattern. You get a surge every 6 months. So we are going to have to start thinking about how do we tailor a society around these repeated surges? Do we just simply have a quiet period where we just don't party and we don't congregate indoors every 6 months? Or do we get to a stage where we just tolerate it? We don't shut down the country for flu every year when the flu season comes along. So there's a lot of thinking to be done about what do we want to do about this? If the vaccine continues to work the way it is, we are essentially going to have a flu vaccine with COVID every 6 months, perhaps every year. And we're going to just have to make our peace with how we want to live with that.
And I guess for other countries, the lesson that we can learn from Israel is that, the COVID-19 fighting strategies should go concomitantly with the non-pharmaceutical measures to fight this virus.
Yes, but I think that we also need to be conscious that vaccines are by far and away the most effective way out of this mess. The non-pharmaceutical interventions, the kind of do as much stuff outdoors, don't congregate indoors. If you do, try and keep your windows and doors open, wear a mask. Those interventions are mitigating factors. And I think Delta has shown us that if you get to a stage, the Delta virus is so much more transmissible than the previous one that came in the second wave for South Africans, the Beta variant, and then the wild variant that happened to us a year ago, that these non-pharmaceutical interventions have a limit to what they can achieve. And certainly in South Africa, the Delta virus seems to have swept its way through despite these various limitations that we've had in place. People can protect themselves to a degree, but there does come a stage where the transmissibility is so high that no reasonable measures outside of locking yourself behind closed doors is actually going to protect you.
All right. Now, let's talk about the discovery of the Lambda variant. I mean, this variant is likely to drive panic across the board. What is this Lambda variant and how is it different from the other variants?
So, firstly, the Delta, I think people's heads are probably spinning with all these Greek terms that are coming out at the moment. The Delta variant, which is the one that's displaced the Beta variant. The Beta variant was the one that hit us in the second wave. The Delta one is the one that's tearing its way through most of the world at the moment. The Lambda variant is the one that's hitting South America. Now, viruses evolve, and this virus evolves to become as transmissible as possible. It accumulates some mutations that make it just more likely to infect you. And what happens is each mutation, when it starts getting much better than the previous version, that one predominates. And that's what's happening in Lambda in the South America. Now, what we have to anticipate is Lambda is going to come up against Delta. So perhaps Lambda is more transmissible than Delta. Perhaps it's better at like taking hold. And those head-to-heads are going to come. We're going to see very, very quickly. But people need to understand is that the Delta virus in South Africa is the one we need to be worrying about at the moment. There's data today to suggest that it's almost completely displaced the Beta variant that was here in the second wave and completely obliterated the first wave wild-type one. So at the moment, we need to be worrying about the Delta variant with a beady eye on the Lambda variant. The good news is that it seems like the vaccine's able to work against both all these variants in terms of keeping you out of hospital. So the message is protect yourself in the third wave with all the stuff, just try not to congregate indoors, wear a mask, all the stuff we all know for the last year, and just get the vaccine as quickly as humanly possible, anticipating that the scientists will tell us when the Lambda variant, if it actually gets there. There hasn't been a single Lambda case yet described in South Africa, which is reassuring.
And without reading into this Lambda variant in isolation, what's the likelihood of emerging variants threatening the efficacy of COVID-19 control strategies?
So, the variants themselves, I think the Delta variant has demonstrated across the world that it's able to break through the non-pharmaceutical interventions and seed itself very, very, very quickly. Certainly in Gauteng, if you look at the numbers, it's unprecedented rise in new infection rates. And we're starting to see it in many of the other provinces, including the Western Cape, in Limpopo and in Mpumalanga. So, I think again, as I said, the virus tend to evolve to get past the non-pharmaceutical interventions and to infect as many people as humanly possible, because that's how it grows. It essentially needs a warm human being to actually grow itself in and then to spread on to the next person. I think we can anticipate there will be drugs coming out possibly in the next 6 months, which will help us to prevent getting the virus, much like the vaccines work, but sort of an add-on, as well as a way to treat yourself in the early phases so that you don't progress, you don't feel so grim, you don't spend 2 days in bed, or progress to going to hospital, much like the vaccine does. So there'll be a hodgepodge of these medications, understanding of the non-pharmaceutical interventions that we as public health and scientists and people need to still put together to try and see what's the best way to deal with what is almost certainly going to be a fourth wave in November and December in South Africa.
So, Prof, are we likely to discover scientific and perhaps pharmaceutical ways of countering the mutations of these viruses?
Probably not. I think that there's so many people with the virus inside them, and viruses just mutate because this is just what they do. They're always mutating as a strategy to get past your own immune system, but also as a strategy to spread more effectively. So I think we can anticipate that the virus is going to be circulating amongst us. You and I have had coronaviruses since we were children many, many times over. There's 6 or 7 of them that circulate. This one probably is slowly adapting itself to us. It's just the fact that people are getting it much older than they do with the other ones, and our immune systems are just not great at dealing with it as we get older or when we've got comorbidities. So I think we can anticipate that these viral variants will evolve over and over again going forward. And then finally, the virus is going to find out it's either going to be one variant or 2 or 3 variants, which are the most transmissible. They're going to luck out, and we'll be stuck with perhaps Delta, Lambda, and whatever other one there is circulating. Our vaccines will make sure that we stay at least out of hospital, but possibly that the vaccines and medications mean that we just deal with it more efficiently.
And can the unusual set of mutation render the different variants capable of neutralizing antibodies?
So yes, they do seem to demonstrate, particularly Lambda, worryingly, does seem to demonstrate, and some of the other variants as well, demonstrate the ability to get past the antibodies. But you need to remember that we have so many redundant immune systems within ourselves. I think everyone's heard of the term T-cell immunity. It's not just antibodies that are protecting you. There are all sorts of other things in your immune system that seem to be able to switch on and switch off at the drop of a hat to take care of it. And the reassuring thing we have so far, and the thing about the coronavirus is it teaches us to be very humble as scientists and not to make broad pronouncements. But it is very reassuring that T-cell immunity seems to still be maintained with both the Lambda as well as the other variants that seem able to get past your immunoglobulins. So with a little bit of luck, if you've had previous COVID or you've had vaccines, that T-cell immunity, as well as other immunity, will still provide a lot of protection, even though the immunoglobulins, it's still able to get past.
So do you think then that a link can be established between a certain brand of vaccine with, with the capabilities of dealing with a certain strain of a variant?
So that's possible, and we certainly have seen that some variants are able to get past the initial immunity of different vaccines. For instance, it does appear that the Pfizer vaccine is probably the one which is able to withstand the current variants the best, and the Moderna vaccine, what we call the mRNA vaccines, which is just a certain technology, new technology that we use. Okay. So that may be the case. The good news, again, though, it's important for your viewers just to understand is that they all stop you getting into hospital. So maybe it doesn't mean you put you in bed for a day or two. One might be slightly better than the other. Yeah. But every single one of the ones that are available in South Africa stop you going to hospital almost 100%. Not quite 100%, but very, very close. So rather than worrying too much about which vaccine to get the first one that's offered to you by the South African government or by the medical aid or whoever else is being offered to you. It's going to do it's going to allow us it'll allow you to survive the fourth wave. It'll allow you to simply buy us the time to work out what's the best strategy to protect people in the longer term. We have to get back to living our lives again. We cannot have a society where we are hiding behind closed doors all the time. And the nice thing is that I think in the next year or two, we will have all those answers as to what's the best vaccine, what's the best strategy, and allow us just to get back to normal life in South Africa again.
All right, Professor Venter, great chatting to you. Thank you so much for your time.
Thank you.
Professor Francois Venter, Divisional Director at Ezintsha at the Wits University, speaking to us about the discovery of the Lambda variant here in South Africa.